My name is Lucas Phim, and for my contemporary health issue, I chose to research autism spectrum disorder, otherwise known as ASD. ASD is a disorder that affects the social, communicative, and developmental skills of an individual within a broad spectrum of severity. Many individuals with ASD are capable of independence. However, those on the lower end of the spectrum require a plethora of assistance and resources in order to function in our society. Being that I am an educator in the special education realm, I have a particular love and interest for individuals and families living with ASD. For this reason, I made it my intention for this assignment to explore the health impacts and current treatments, screening techniques, and social issues associated with ASD. The truth is that autism spectrum disorder has become an increasingly diagnosed disorder year after year, and with its increasing population is an awareness of its causes, traits, health consequences, and possible prevention techniques and treatments. ASD has profound health impacts on families and individuals suffering from the disorder, and its growing awareness and research is key to understanding, treating, and preventing ASD. One of the more observable recent occurrences surrounding ASD is the drastic increase in individuals being diagnosed. According to a 2018 article from Autism Speaks, the number of children being diagnosed has jumped in 2 years from 1 in 68 to 1 in 59, a 15% increase. The reason for this phenomenon has not been explained entirely. However, researchers believe that its increase comes from the greater research done on the symptoms and risk factors associated with ASD, making it more recognizable. As the number of individuals with ASD continues to jump, there is a greater need for resources available in order to adequately support those individuals. With an increasing ASD population comes a clearer view of the demographics pointing to the disorder. What's apparent is that families on the lower end of the socioeconomic spectrum are diagnosed later in life or not at all, due to a scarcity of resources and health care. This is especially important because early diagnosis is essential for developing skills for children with ASD, and if not learned early on, these skills become more difficult to acquire. As autism awareness increases, the link between mental health issues and autism in adults is becoming apparent. Not only can autism impact the health and wellness of an individual suffering from it, it can also have health consequences for parents and family members dealing with a child with ASD. Risk factors and prevention techniques are a highly studied topic in the world of ASD. Risk factors for autism have been linked to environmental components as well as genetic. Prevention techniques can include simply altering environmental factors. However, recent scientific advancements have found ways to catch signs of autism in prenatal stages and provide preventative therapy. Currently, health professionals continue to look into genetics and its effects on autism as a way to learn more about the disorder. Researchers are also looking at ways to implement technology into the development of the communicative and social skills of individuals with ASD. Going forward, researchers aim to look into the benefits of movement and dance when it comes to improving symptoms of ASD. Researchers are also developing screening techniques aimed at treating autism in underserved, low-literacy communities. As we continue to learn more about autism, putting an emphasis on treatment in the educational setting is essential. It's important to think about how we may prepare this new wave of children with autism for adulthood and how we might influence young individuals with ASD to become functioning members of society.